So welcome everybody to this Data Science for Health Equity Participatory Research event. We're really excited to invite our speakers today, Sarah Rabbitte and Amy Wilkins, who have been working on a really interesting project, including a really interesting and diverse group of people in their participatory research. And so we're really excited to hear more from them. I thought I'd just give a little intro about data science for health equity for those of you that aren't familiar with the organisation itself. So we're all part of a voluntary organisation that looks to host webinars, build community networks all around different subjects relating to data science and health equity. There's lots of ways that you can get involved. You can attend these webinars or you can get involved in our Slack channel. And we also host all different types of subjects. So whatever your interest, please do feel free to reach out to anyone in the community and see what you can get out of it. But without further ado, I will hand over to our speakers to introduce themselves and get started before we go into a bit of a Q&A. So please do think of some questions if you've got any you'd like to ask. But yeah, over to you, Sarah and Amy.
Thank you. Can you hear us okay?
Yeah, that's great.
Yeah, sounds good. So hello everybody, welcome. Like Eleanor just said, it's great for us to come and talk to you today about the meaningful participation of people with learning disabilities in research. We've got an agenda today. We wanted it to be quite informal though, so please feel free, like Eleanor said, to put your questions in the chat and hopefully we can answer some of those. We're going to do some introductions about ourselves, who we are, an introduction to the research project that we've been working as part of, which is called DECODE. So we're going to tell you what that project's about. We're going to talk about participation, so how people with learning disabilities did get involved and did participate in DECODE in a few different ways. Some of the challenges that we face, because that's usually something that people sort of particularly ask us about, what challenges did you come across? And then we thought in our achievements section, we'd address some of the ways that we sort of overcame some of those challenges to make people's participation meaningful. And then right at the end, some of our outputs, some of the things that we've co-produced with people, and then some sort of tips, some learning points that we found about how to make people's participation meaningful. So I'm Sarah. We were laughing there, quite big pictures of us when we put this together, so taking up half the screen. So I'm a learning disability nurse by background. And I qualified in 2016 and I worked clinically as a learning disability nurse. So I worked with adults in the community and that was a really varied job. It was like lots of interventions with people's mental health and sort of overcoming those barriers to accessing physical healthcare services with people. But in 2022, so just over a couple of years ago, I was really lucky, saw this role in DECODE advertised as a research nurse. And I guess I was inspired to go and work in research because there's a real lack of evidence base with people with learning disabilities, and that's something that I noticed particularly when I was working clinically as a nurse. In DECODE, my role is all about co-leading the patient and public involvement, the PPI groups, alongside Amy, and also supporting people with learning disabilities who join the project as a participant.
Thank you, Sarah. My name's Amy. I am a speech and language therapist by background, and the same as Sarah, I worked clinically with children and adults before joining DECODE around the same time in 2022. So this is my first research role as well, and we've been on a big kind of learning journey about lots of different vocabulary, concepts, patient and public involvement, and we've learned a lot over the last 2 years. And I think I was inspired to join this project just because it was a really unique role. There doesn't seem to be many opportunities for speech and language therapists to get involved in research, and especially as a kind of stepping stone where you don't have to lead your own project, but you can work alongside a large team and learn a lot about research. So I think it's quite a unique role, and I haven't met many people who are kind of involved in these large scale projects. So it's really exciting. And I also support the patient and public involvement groups and support the researchers to adapt their communication and break down all the kind of difficult concepts in the research to be able to help them share their ideas and understand the kind of information and the concepts that we're going through. So because we appreciate that this is quite a broad audience, we just wanted to tell you a little bit about the kind of population that our project is about. So we are looking at adults with a learning disability, so anyone over 18 who has a diagnosed learning disability, or in other countries, they might refer to this as intellectual disability, particularly in America. So if you're reading papers, you might see it referred to as that. But we did a little bit of work with our patient and public involvement groups, and they told us that they preferred the term learning disability. So that's how we kind of refer to it, but they do mean the same thing. So a learning disability affects a person's whole life. So it could be things like their communication, their ability to do everyday tasks, socialising, managing money, things like that. And the World Health Organization classifies this into mild, moderate, severe, and profound. And the majority of the people who've been involved in the DECODE project fall on that kind of mild to moderate learning disability. And to capture the sort of views and perspectives of people with more severe and profound needs, we've included family carers and paid carers as well as part of the project, so that we can sort of try and get a broad perspective from different people's thoughts on what we're doing in the project. So just quickly, a learning disability differs from a learning difficulty. So just to make that quite clear, that a learning difficulty might be something quite specific, like dyslexia, so problems with reading and writing, like dyscalculia, so problems with maths, and that would differ from a learning disability, which affects a whole person in all tasks. So we do make a distinction between learning disability and difficulty when we recruit people to the project. Okay, so a little bit about what the DECODE project is. So we have this really long, complicated name, which you can see at the top, which has been kind of shortened down to DECODE. It's not even an acronym, but basically what the project is doing is using artificial intelligence to look through the health records of people with learning disabilities and to find what the clusters and trajectories are in different conditions. So, for example, if a person has high blood pressure at 20, for example, does that mean they then go on to develop heart disease at 30? So we're looking for those patterns in the data. So that's the data-driven machine learning part. And then we also want to kind of think about how we can translate that information into something meaningful. And in a bit, we're going to go into the different work packages, so I can tell you a little bit more about that. But our project has been funded by the NIHR for 2 years, kind of 2 to 3 years with a little extension. And we've got lots of different organisations involved from all over the country. I think there's probably 25 to 30 people involved, but the majority of staff are based at Loughborough University and myself and Sarah from Leicestershire Partnership Trust. And most of the researchers' backgrounds are in things like data science, so the numbers and the algorithms, and design, so things like how can we translate this information into something visual for people. And the two PIs of the project are Professor Thomas Yun and Satish Gangadharan from LPT. So these are the two main people leading the project. So we've got one person in healthcare and one person in design, which is really nice because then we get to see things from both perspectives. Okay, so here's a kind of a diagram of the different work packages that we have in the project. So work packages basically just means the kind of groups of people and the different tasks that they do. So work package 1 and 2 was all about the data. So things like cleaning the data, which means getting the data ready and usable, and then applying the AI algorithms that kind of scan all this data at a much quicker rate than humans can to look for those kind of patterns and clusters that I mentioned earlier. And from that data, we've started to get some results. So things like we've found the top 10 health conditions that adults with learning disabilities typically get, and we've got differences between men and women in those top 10 conditions. And then we've got a number of trajectories, so common conditions that occur together, and again they're slightly different between men and women, but we now have some really exciting data about conditions and the length of time typically between conditions. And now this doesn't necessarily mean that while one person has a condition, they're definitely going to get another condition, but it's useful information that we're hoping in kind of the next phase to be able to feed into the annual health checks, which is annual health checks are something that adults with learning disabilities have once a year when they go and visit their GP. And we're hoping that we can use this information if doctors can have a prediction of what a person's health outcomes might look like, that they might be able to start doing tests and preventative measures earlier. So that's really exciting. And then work package 3 is about how we can turn all that data into something really meaningful. So graphs and charts are not necessarily going to be accessible for a person with learning disabilities and their family to understand. So we've been working on what is the best way and how do people with learning disabilities best understand information. And we've done quite a lot of work through focus groups and interviews, and found out that some of the best ways are through videos and animations, because you can play them again, you can digest that information in a visual and a verbal way, and it's kind of concrete. So we've been working on some animations about how we can let people know about these kind of different health trajectories and things they can do to improve their health. And that's kind of in the early stages as well at the minute. And then work package 4 is thinking about how we can use all this information that we've got to improve effective healthcare coordination for people going forward. So again, through lots of different focus groups and workshops, we've been looking at different use cases and kind of trialing would these work in the real world. So things like a dashboard for doctors to use, apps, ways of improving annual health checks, different ways of like commissioning and things going forward. So we've got lots of different ideas and things that we hope to present as potential use cases in the real world. And then underpinning all those 4 work streams are our wonderful public and patient involvement panel, which we've got a mixture of people with learning disabilities, professional carers and paid carers, and they've been involved at all stages throughout the project to help us design material, check that things make sense, check that the findings that are coming out of the data are applicable to real people. And they've been helping us kind of plan lots of interviews and the workshops as well. And at the very bottom, we've got some research participants who have been kind of testing out the different visualizations, so like posters, animations, and the use scenarios. So we've had people with learning disabilities involved in both the PPI and as research participants in both forms. So just a little bit of background information about why we think DECODE is really important. So people with learning disabilities, that's what the acronym PwLD stands for, make up about 1% of the population. But we know that although that's a really small percentage of the population, about 67% of them have multiple long-term health conditions. So that means more than one health condition that lasts a long time. And kind of from the data, we've found that the mean number, so the average number of multiple long-term health conditions is 12. And that adults with learning disabilities die often 10 years younger than the general population from often preventable causes. So while this is a small group of the population, they're probably having a large impact within the NHS, because we know that they've got lots of health conditions and lots of things that are preventable that we could maybe proactively support with if we have got a kind of projection into the future about the health conditions that people might get. So we're hoping that DECODE can help by firstly identifying those patterns and having a look how these things develop over time from past healthcare data, and then create plans to help people get treatment earlier for some of these conditions, and think about how we can create a model for coordinated care a little bit better to improve the lives of people with learning disabilities, so that everyone is working together in a preventable way.
Thank you. So that was a really great overview of what DECODE is and what it's all about as a project and what we were aiming to do. And I guess like me and Amy have mentioned that we were completely new to research. So we had clinical experience of working with people with learning disabilities, but not a lot of knowledge about people with learning disabilities and research, really. And it probably didn't shock us, because I think because we know the health inequalities that this population of people experience, which are, you know, really, really horrific and really significant, like Amy just said on those slides. But it probably didn't come as much of a shock to us that people with learning disabilities are often excluded from research as well. So people are not involved in planning applications, so right at the start of projects, when they're being sort of formed, ideas are being shaped, people with learning disabilities are not directly involved with that. They're not involved in the research design, and they're not involved in dissemination as well. And there are some, we kind of had a look at the literature, and there's not much, it is very sparse, but there are some known reasons as to what these barriers are, why people don't often participate. I guess a big one is looking at people's capacity to consent to be part of research. So it might be that because a researcher is told that someone has a learning disability, because quite understandably, you know, a researcher might not have met a person with a learning disability before. It might just be that they think, no, because of that, I'm afraid you can't take part in research, when actually, you know, people might be very capable and very able to consent. There might just have to be a process that's looked at. In terms of communication, that's an absolutely massive one with this population of people. I guess in research, you're having to translate some very complex information. So as an example, you know, DECODE was looking at artificial intelligence, which is an extremely complicated and broad subject, actually. So actually it might be seen as something that's quite specialised in terms of really simplifying this information, and therefore it's not done. And if the information isn't simple enough, then people just can't understand it, and therefore they can't participate in research. As we said there, it's kind of documented that people might be just perceived to lack the knowledge and understanding to take part in research. And then there's the topic of acquiescence, which certainly me and Amy have found out much more about since we started working in this project. Acquiescence, if you haven't heard of it, basically means it's sort of passive assent to or compliance with something. So whereas it's not the same as someone kind of knowingly kind of guiding somebody towards an answer. It can be something that's sort of kind of subconscious, and people with learning disabilities are quite at risk of experiencing that in research. So it might be that people are telling the researchers something that they want to hear. So actually it skews the data a bit, and it means that the things that we're hearing from people might not be accurate. So there's lots of reasons why people might not be offered opportunities to be involved in research. And I guess this is where we thought we came in, and what's been really fantastic about having two specialist health clinicians in the project, because me and Amy have kind of got that experience and we've got that background with working with people. And it meant that we were able to pick up on some of these barriers. And in further slides, we'll tell you about how we overcame them. But we've had a big role in all of these areas. So we had a big role in recruitment. I won't go too much into what we did because we'll cover that in a minute. But we had a really specific role with capacity assessment. So actually going out and meeting people who wanted to take part in the project, so that we were able to assess their capacity in a kind of informal way, nothing too scary, but just making sure that we were giving people all the available opportunities that we could, so that they could join the research. We had a really big role in supporting communication, supporting that participation, often in quite a physical way, wasn't it? So using lots of visual materials to do that. We offered some training right at the start of the project to the researchers who didn't feel that experienced. So we were able to do that right at the beginning and kind of guide them with what things they should be considering with working with people with learning disabilities. And we've more recently, as the project is sort of coming to an end because it ends next March, we've been looking at supporting dissemination of the research and how people with learning disabilities can get really involved in that. And I think Amy's probably covered a lot of this slide, but we got people with learning disabilities involved in different ways in DECODE. So we had quite a lot of people involved in the PPI side. So right from the very, very start of the project, even right from the sort of ethics application and the recruitment process, we had our PPI members that have just been fundamental to everything that we've done, and they've helped us to design how we've done the research. We also had people with learning disabilities as participants in interviews. So in the interviews, we spoke about trying to identify enablers and barriers to care coordination. You can see, if you can see that picture, we made it quite visual. It was quite good, wasn't it, really, to design it and to do it like that in a really, really visual way. And then we also held focus groups and workshops throughout the project as well. And we have people with learning disabilities involved in them. And that was really to produce the animation that Amy mentioned earlier, to make the outputs of the DECODE project really visual.
So as with kind of any new project, there's lots of challenges. And these are some of the ones that we came up against, and I don't think these are unique to our project. We've met quite a lot of people throughout this project who have been running PPI in different studies, and a lot of people have kind of had these same challenges. So firstly, with recruitment, we found it quite difficult to recruit and retain family carers and paid carers. And some of the difficulties with this was things like shift patterns, working, not being able to get the time to kind of come to the group meetings was a bit of a challenge. And that's something that I think we've struggled with throughout the project. We've had really good recruitment and retention for the PPI with learning disabilities, because they really enjoy coming to the group. They don't necessarily have as many commitments. They're more flexible in terms of when we can meet. So we've had kind of mixed depending on the different groups to do with recruitment and retention. We also came up against the barrier of travel right at the beginning. So when the the project first started, people were expected to book and pay for their own travel up front to get to meetings, which we realised very quickly was going to be a big barrier, because a lot of these people are on benefits. They can't afford to pay up front £60 for a taxi to then claim it back. And the way people were trying to claim things back was very complicated. I'm sure you've all seen claims forms with tiny little boxes where you've got to fill in all the numbers, and they're very inaccessible. So people found it difficult to kind of book their own transport and get there themselves and pay for that up front. We had to think about the accessibility of venues. So were they easy to reach for people? Did they have things that met all the accessibility needs? And also in terms of accessibility, the research materials. So things like the claims form, the PowerPoints, the any kind of documentation, the agenda. We had to make all these things more accessible, and we did that by using a strategy called Easy Read, which is with pictures and simple information. So we had to spend time kind of converting lots of traditional documents into things that people could access. Also people's complex communication needs. So we found that we needed a higher level of facilitators to PPI member ratio, so that we could sit with people one-to-one, talk about concepts, go at a kind of slower pace, allow more time for people to engage in activities. And we spent quite a lot of time getting to know people's kind of individual communication needs so that we could personalise things to different people. For example, some people we know like a physical printed letter, they don't have access to email. So we were learning about how people like to receive information as well. And we've talked a little bit about the complexity of topics like artificial intelligence and thinking how can we explain these really complicated topics. So we've done lots of things visually, we've done things through role play, we've brought physical objects, we've tried to link it to tangible things, and we've allowed more time to go over those different topics. So I suppose our achievements is how we've kind of come over these some of these challenges. So we try to make our meetings a little bit more social and fun. So we have things like refreshments. For the groups with adults with learning disabilities, we always meet face-to-face because often they don't have access to technology. Being in the room with someone, it's a lot easier to say, oh, I don't understand that, can you explain it again? And for the family carers and paid carers, we often meet online because they say that that's easier for them. So we've tried to make adaptations based on kind of the different groups' preferences. We also managed to organise prepaid transport. So we now book everybody's taxis and prepay for them so that people don't have to faff around with trying to book their own transport and pay for that up front. So that's we're really lucky to have that. We've sourced some local venues which are quite accessible, and now we regularly use the same places so that people are familiar with it. And we've converted a lot of information into Easy Read, and we've also made audio and video versions of quite a lot of things, including we've got a video on YouTube, what is research, what is DECODE. I think we've got one coming which is about what is AI. And we also made our participant information leaflet Easy Read and audio as well, so that people could access that in different ways that was more appropriate to them. And we've worked quite closely with the researchers, one-to-one, looking at any PowerPoints they might want to bring to the session to think, are these accessible? Are the jargon that you're using, do we need to explain that? So we've worked quite closely with the team to upskill them and help them be able to deliver information in an accessible way as well. So just a little bit of a recap on how this kind of co-design improved the research. So it made it really relevant for the group of people that we were researching. Quite often we would come with an idea and people would go, oh, well, that doesn't make sense. I think you should do it like this. Or I wouldn't do it like that. That would never happen to me. So it kept it really relevant for the people that it was about. And it helped us to check that it made sense. Again, we might come with an idea and people would say, well, that's not right. That doesn't happen at annual health checks. So we had people telling us how it really was for them. The researchers got to understand the population that they were researching a little bit more. So, like I mentioned, they were often not from a background that worked with people with learning disabilities. So it made their research more real and concrete. And quite a lot of the researchers came to us and said, oh, now I really understand why we're doing this research, once they came and met the group. And it was a lot more personal. We have considered how we communicate information. So we've had to make a lot of changes to things like the website, and people have had to really consider how they present and talk about the research in a way that's easy to understand and accessible, because I think people use jargon all the time because that's the natural language that they're using, and they're often talking to other researchers who understand that too. But we've done a lot of work on breaking things down and communicating information. And we've also created lots of opportunities for a group that was previously underserved in research. And lots of people in our group have gone on to do other things. A few people have applied for other jobs and used the work that they've done in DECODE as part of their application. We've taken lots of people to co-present with us at conferences. So people have had lots of opportunities that they wouldn't necessarily have had unless they joined this project. So we've done lots of exciting things. We've kind of co-written papers together and lots of presentations.
Yeah, and these are just, I guess, some examples of those outputs, like Amy's just mentioned, in terms of being able to see those opportunities that people have had that maybe they wouldn't have necessarily had before. The animation was a really great example. So the animation will hopefully, we're hoping will be finished
in the next couple of months.
In the next couple of months, yeah. And we want it to have a really wide reach, particularly for people with learning disabilities and carers. The animation itself, we were really pleased that one of our PPI members, so a person with a learning disability, there's a picture at the top there of those, them going into recording studio, and they were able to voice over the animation, which was really exciting. As Amy mentioned, we have a journal article. It's been submitted for publication, so it's under review at the minute. So we're very hopeful that that will be published, and that's basically a journal article all about our work. So sort of what we're telling you today, our work and how we've done it. But what was really amazing about that is that we've co-authored it with two of our PPI members, and I think that was something that, again, that was really great to do. And I guess we had to be creative with how we were going to do that. It wasn't a case of we just said to people, can you write me 2 paragraphs and, give it to us by the end of the month. It was doing things like going out, speaking to PPI members about what the article was about, maybe capturing their quotes and their feedback in a verbal way, and then us being able to shape the article around that feedback that they gave us, which was really good. We've been able to, again, co-author some newsletters with our PPI members. I think one of them had a more kind of national reach, so kind of getting the news out there about the project in any way that we can, and kind of shouting about it and doing that alongside our PPI members. And then in terms of dissemination, we organised a research forum in our NHS trust, and we co-presented that along with one of our PPI members. As well. And again, that was really great because it meant us just spending some time with him, listening to his thoughts, what he wanted to say, and incorporating that into the presentation as well. And these are some examples of materials that we've co-produced with our PPI members. On the very top right, we used a lot of visual things like emotions cards in our focus groups. In particular, we use those, and we have used those in our PPI meetings. And they're just a really great way for people who might have some feedback about a topic but are really struggling to put it into words. So actually, with these cards, people can sort of point and indicate and say, that makes me feel happy, or actually that makes me feel scared. And then through discussion, we've been able to then kind of pick out reasons why someone feels like that. We've got a PPI handbook, which is something that we can give to PPI members at the start of the project so that they know what is involved with getting involved with PPI. As Amy mentioned, our patient information sheet, we made an easy read version of that, which was a lot shorter. And just basically had the relevant points in. And like Amy said, we made a video version of it that people could watch. And we were also able to go through the form verbally with people as well. And the videos that Amy mentioned as well that are on our website. Again, they're just a nice way for people to be able to maybe watch and listen to something rather than just have all information in written format, which just doesn't work for everybody.
I like coming to the DECODE.
Oh, I can hear the sound.
Did you hear that sound? I don't know if I've shared with sound.
Yeah, it was all good.
It was good.
Fab.
So we've just got some feedback from a couple of our PPI members, and this is just them sharing what they get out of the group.
I like coming to the DECODE meetings because it is very inclusive. Anyone, whatever their disability, can come and everyone's opinions and ideas count. It is very reassuring to know that there is help out there to keep us fit and healthy.
Do you want the whole video?
Yeah,
Or just
a really short one, I think.
This is about a minute long. Have we got time? I know it's kind of about 1:45-ish.
Yeah, no, honestly, carry
Yeah.
on. Looks great.
Well, I like learning things new. I like being part of a team, and I like knowing them helping making a difference to people's lives in a way. I'm learning what the project is about, and I'm gaining more knowledge. And I like at the end that we talk about it, whether that's easy to understand or is that a bit too much. And then we find a solution, what would make it actually better. I would just like to say thank you for asking me to join the group, and I feel happy to be part of the group. Well,
Okay. So there's also a longer version, about a 6-minute version of that video with different PPI members on our YouTube, which when we stop sharing them, we can probably put the link in the chat. So just kind of quickly, as we're coming towards the end, we just wanted to share a few awards that we were nominated for. And the main reason that we were nominated for most of these awards was because of our patient and public involvement within the project. I think it's been recognised that our PPI members have had a really big impact, and that's kind of been recognised through some of these awards, which has been really nice. And we've been able to take different members from our PPI different groups to the different award ceremonies, so people again have been able to have different experiences as part of the team. And I think they have been really included as part of the DECODE research team, which has been really nice. So in summary, some of the learning points that we've kind of taken away is to think really simple. Do people really need to know about how to write an algorithm, or do they just need to know about what some of the risks might be with using artificial intelligence? So think about the information that people need to know that's relevant to what you want to discuss. We've had lots of feedback that sharing the progress of the project is really important to people. And even if for whatever reason something's going wrong or something is taking more time, they want to know that, and that they're okay with that. They just want to kind of keep up to date and know that. involve the researchers right from the beginning so that they can kind of see the humans behind the numbers. And I think if we did it again, we would maybe try and have done that a little bit earlier, so that people can kind of meet each other and the researchers, and each group really doesn't see the other group as kind of a scary group of people. Make things at the meetings visual and fun. Lots of people have said that they really value the social element of the group. So they like to meet regularly once a month, in a shorter meeting than perhaps have a longer meeting every 6 months. And you can enhance people's skill set, including the researchers and PPI groups, so that everyone can kind of take something away from the learning experience. So there's some of the things that we've learnt. I'll stop sharing now, and then if anyone's got any questions, we'd be happy to talk about that. Stop.
Oh, thanks so much both. That was so interesting, and like it was just amazing to hear the impact not only on the project but also on the people that were involved. I think that's something that we don't always think about, is that we are providing opportunity for these people at the same time. So yeah, really amazing. And I just wanted to echo actually some of the videos that you mentioned, like the videos what is research and things like that. I feel like could be really useful for loads of people in the audience of this. So and I think those things we shouldn't be replicating. If someone's already done it really well and there's a really clear explanation, then we should absolutely be using that rather than trying to create something the same but different. So if you're happy to share that, I think everyone would be really grateful for that resource. We have a quick question in the chat, which I wonder whether we should just answer now before I hand over to Jo. So the question is about consent and is it better to consent people in person, or are there other ways, and whether you have any thoughts about that?
Yeah, so definitely we did all our consent in person. So I think we wanted to be confident that so it was not necessarily just about consent, it was also about the capacity to take part. So me and Sarah went out and completed capacity assessments, and basically you're looking for in that assessment, can the person understand the information you're giving them, can they retain it, can they weigh up the pros and cons of joining, and then can they communicate back to you? So we wouldn't have accepted consent unless a person had passed that capacity assessment. So the things that we did for that capacity assessment was we sent the information ahead of time, either in the post or electronically, or both usually. We would then go through that information again with the person on the day, and then we'd ask them some questions about that information in the document to check that they had understood it, weighed up the pros and cons, and then could communicate that back to us. So definitely we always did the capacity and consent process in person.
Yeah, it was something in DECODE's ethics application that came back, that we had to have sort of a really robust way of assuring that the people with learning disabilities that took part could give their consent, and we had documented that as well. That's not to say other people, if there were family members, carers that joined, or other health professionals, we probably sometimes took their consent, maybe sent a consent form online and maybe filled it out before, but definitely for the people with learning disabilities, it needed to be face to face.
And I guess that your expertise and your past, experiences in working with these people has allowed you to, you do that effectively. And I think if people aren't so familiar with that working environment, that might be more difficult. So yeah, perhaps having that expertise in-house is something that's pretty useful in this scenario. But yeah, I'll hand over to Jo then for the next question.
Yeah, thanks, Helen. Thanks both. Really great presentation. I can see we've got more questions coming in the chat, so I'll keep this one brief, but I do have some follow-ups, perhaps if we have time later on. You mentioned Easy Read a couple of times, and I just wondered if it might be worth unpacking what Easy Read is.
Do you want to say?
Oh,
You
okay.
take that one.
So Easy Read is a form of accessible communication. So there's lots of guidance online about how to create easy read information, and there's different ways of doing it depending on kind of what it is you're trying to explain. But usually what easy read is a picture with a simple sentence, and the picture and the sentence relate together. So I think, I don't know if there was any examples on the slides that we had, but it's usually how you present information as well. So larger font, lots of space between the lines, making things really clear, and it's kind of how you back up information with a visual. There's lots of advice and guidance online if you Google how to create easy read information. But one thing we would say is test it out on your PPI group, because we sometimes thought that we'd written something in an easy read way and people would be like, what does that mean? Or that picture doesn't relate to that topic. So yeah.
Yeah, we thought it was really good. And then people were like, no, you need that doesn't make sense. That doesn't make sense. But yeah, I guess what it meant was that just the standard sort of patient information sheet was just this, I don't know,
just
six-sided document of words. And actually what Easy Read does is you just strip away all the parts that you don't really need to know. So we obviously kept in the parts like where data, where people's information would be stored, confidentiality, what they were going to be doing in the research, but some of the other parts were just words really. So it was just a process of stripping it back and just including in a really simple way what people need to know in order to be able to consent to take part, basically.
Yeah.
Sorry, Alda, could I just ask one quick follow-up on that? So, and again, this might be an experience that people on the call have, but sometimes we write our participant information sheets and design them deliberately to be straightforward. And then while you go through the approvals process, necessary additions come in from various bodies, very specific wording from a university saying this is exactly what our data protection policy says. And what was quite a straightforward short document ends up becoming multiple pages of quite complex legalese. And so I can really see the value in that simplification, but I guess it's a challenge to all of us, isn't it? How do we advocate for simplifying everything? Because even if we're speaking to people who don't have learning difficulties or learning disabilities, it can still be valuable to keep things simple.
Yeah, and all of our easy read information went into the ethics document, so it was approved at that level. So that was helpful.
Yeah, but I think, like you say, I suppose it's not helpful, is it, when you have to add in things that. Yeah, I'm just trying to think if they asked us to add anything else into our easy read versions.
No. They didn't specify that we must include certain words. I think it was more about the concepts and how the concepts were explained.
That's really interesting. Thank you both. So next question from the chat starts with a really nice bit of positive feedback. Amazing presentation. So well done, you. And the question, I think, is talking about this idea that perhaps you might not do participatory research with just members from this sort of community, and you might have a mixture of people of different abilities, and whether you've thought about that and how you might approach that.
I think that's an interesting one, and we were actually approached by someone from another project who was the project wasn't about people with learning disabilities, but they actually wanted to include that voice, and they were asking how would they go about that? Would they need to rewrite all the kind of information to enable perhaps just one person to participate? And actually they did go away and do that for one person to participate, which is not always going to be, I don't know, necessarily feasible in all projects, or people don't have the expertise, which I guess is why often people with learning disabilities, and I can see the next question I think is kind of similar perhaps, they don't necessarily include people with learning disabilities in research for the typical population because they don't necessarily know how. And we also held an event recently which we called a World Cafe, which was a mixed event. So it was professionals, family members, carers, people with learning disabilities. And actually, I don't think we ended up pitching it in a suitable way for everybody in the end. And that was like quite a big learning curve for us. What we thought was simple and easy to understand still wasn't enough. And one person did unfortunately end up leaving because they said, oh, I can't understand this, I don't know what you're talking about. And that was quite an eye-opening experience for us, in that hosting a mixed event was very difficult.
Yeah, I suppose it's about pitching it for the majority of people, which unfortunately you can't. I mean, we've got some people with learning disabilities in our groups that actually don't like easy read, that say, I don't like it in that format, I want just a standard letter. And we've tried to adapt to that when we can, and be really personalized, but I get that you can't do that if you're, you know, trying to approach quite a broad audience of people. Yeah, it's hard. I guess you've just got to go with what you think the majority will understand, and then if you can tailor other bits to suit other people's needs, I guess, but that's hard. That's not something that everyone can do. I get that. Yeah.
I think it's interesting, isn't it?
Health professionals on your project.
Yeah. I think that's. I'm getting the impression from you both that you're so experienced in this space that it's, you know, it feels natural to make all of these
I think so. I think a big part of it that we've reflected on a lot as well is that we've had the time as well to do this work. Like, we've been employed solely to, you know, lead the PPI and to create these materials and easy read information, and that's great if you've got that. But we get as well that, you know, other projects don't have that the funds to specifically be able to employ 2 health professionals and have that time. So that's been a really big part of it as well, that we've been specifically employed to do this as well, which I think is relevant.
So I guess for people starting new projects, it would be, could you include something like that in your budget grant when you start at the beginning? Even if it was maybe just on a kind of consultancy basis, if you were wanting to include people with learning disabilities in a non-specific LD project. But I suppose it's just making reasonable adjustments like you would for anyone. So you want to include people with diversity, you want to include people from different ethnic backgrounds, different ages, different genders. So why would you also not want to open that up to people with learning disabilities as another kind of just a group of people? Yeah. And then in terms of, is there a standard capacity assessment? No, we wrote our own, and that was because capacity is always kind of decision specific. So we needed to tell the people the specific information relating to our project. So we kind of wrote that in line with the mental capacity.
Yeah, I'd say following the principles of so can somebody retain information? Can they communicate it? Can they understand it? So we use the 4 main concepts from the Mental Capacity Act, which is something that anybody could do. I think they're the main things that someone should be able to do in order to sort of be deemed to have capacity to understand. So
yeah.
And I think as well, projects like yours can be used as like a case example, can't it? And that's going to be really inspirational for people going forward to see how you've approached it. And hopefully people will find this recording useful. Well, I think, and unless anyone's got any questions, I think we can wrap it up a few minutes early and give people some time back. So I just wanted to say thank you so much both for coming along and chatting to us. I think it's really important that we showcase projects like this so that, as I said, people can use it as a case example, and perhaps integrate some of the techniques that you've used and, you know, from your professional background as well into their own project. So yeah, really valuable. Thank you so much for that, and we hope to see you in some of our future events where you can ask questions to other people in this space. So yeah, thank you very much.
Oh no, thank you so much. And people are, if you want to give our email addresses out, people are more than welcome to get in touch with us if they think of any further questions or there's anything we can answer. Yeah.
Great, thanks very much, Alison.
Thank you.